So now we are going to continue with the mechanism, the risk factors of chronic kidney disease. So for the risk factors of chronic kidney disease, we are going to divide the risk factors of chronic kidney disease into 4. The first risk factor, we are going to have the predisposing risk factor. Is it clear? Then the next, you are going to have we have the predisposing risk factor, we have the susceptibility risk factor. We have the initiating or the predisposing or the susceptibility are the same thing. Is it clear? Susceptibility factor, they are the same thing. Then we have the initiating factor, then we have the next one, which is the progressing risk factor, and then the last one is the end stage. Is it clear? So those are the risk factors of the chronic kidney disease. Now, for the risk factor of chronic kidney disease, the susceptibility of the predisposing risk factor, you need to know that generally we have old age. Is it clear? Is going to be associated with a risk factor of chronic kidney disease. The second one, the race, usually black race is usually associated with more of chronic kidney disease. The third one, if you have any family history of chronic kidney disease, is also a predisposing risk factors for that family issue of chronic kidney disease. The next thing, if you were born with a lower birth weight, in this case, a child that was born with a low birth weight is a risk factor for chronic kidney disease. Is it clear? So all these are risk factors for chronic kidney disease, which are just predisposing. Now, the initiating risk factors, what are the elements that are required in order for you to initiate a chronic kidney disease? You have things like diabetes mellitus. If somebody has diabetes mellitus, it can initiate the risk factor in patients who are predisposed. The second thing is hypertension. If somebody has hypertension, it can initiate the disease in somebody that is predisposed. The next thing, if somebody has HIV is capable of initiating, and this one is predisposing. See, the next one is if somebody has gout is capable of initiating. Is it clear? So those are the different initiating risk factors. Now, for the progressing risk factors, for the progressing risk factors, you need to know that what if you have uncontrolled hyperglycemia, so you are diabetic and you have uncontrolled hyperglycemia, means that the kidney is just going to continuously progressively being damaged. Is it clear? The next one, if you have uncontrolled hypertension, the kidney is going to be progressively being damaged. If you have uncontrolled viral load, is it clear? The kidney is just going to be progressively being damaged. And if you have uncontrolled uric acid level, the kidney is just going to be progressively being damaged. Is it clear? So those are the different elements that you have to note. Are you understanding? Now, after that, now we need to know that you have the next one, which is the end stage. End stage is when the patient is already at end stage renal failure. But what are the things that if you don't do an end stage, the patient is just going to have a complete loss in that end stage renal failure? We have the patient is uncompliant to dialysis. If you have uncompliant to dialysis, you have uncompliance to fluid restriction. Is it clear? Those are the risk factors at the end stage. Is it clear? So those are the different elements that you have to first evaluate in the risk factors of chronic kidney disease. Is it clear? Now, after evaluating for the risk factors of chronic kidney disease, we need now to understand we need to understand the pathogenesis or the problem. I'm just going to speak about the problem inside chronic kidney disease and compare it with the problem inside the acute kidney injury.